Well, thank you all for joining today. We have been doing this series on understanding the different types of dementia. We've talked about Alzheimer's disease, and we talked about vascular dementia. If you missed those and want to learn more about them, they are on our YouTube channel. And today we're talking about Lewy body dementia. And as we get into the material, I mean, how complex all dementias are, but just the complexities that come along with Lewy body dementia. And it is a progressive dementia that results from certain protein deposits in nerve cells throughout the brain. And these protein deposits really end up looking like they're really smooth, round, kind of circles. They're an alpha-synuclein protein that is found throughout the brain. We're not really sure the purpose or what the use of those proteins are, but they called them Lewy bodies. And they called them Lewy bodies because Dr. Frederick Lewy is the one who first found them and recorded them back in 1912. And just as a side note, interesting, he was a contemporary with Dr. Alois Alzheimer. So they were both doing research on the brains in the early 1900s. And that's where we get the names for a lot of these dementias, is the doctors who discovered them or found their research on them and published about them. So these Lewy bodies, those proteins that build up, are mainly found on the cortex or the outer area of our brains, but also in the deep mid area of the brain. And we'll talk about what those areas of the brain do. But this particular dementia is related to Parkinson's disease because of where those protein deposits accumulate. And of course, as we get older, we're all at a higher risk for developing a type of dementia. Lewy body dementia tends to happen, be diagnosed in your 60s, sometimes in your 50s, and slightly more males tend to be diagnosed than women. And they do say that there is a family history. If you have a family history of Lewy body dementia or Parkinson's disease, that you're at a higher risk, but it's real slight as well. It does occur in about 20 to 50% of all types of dementia, and it is being labeled the second most common type of dementia, but so is vascular dementia. So I don't know if it's tied or as we learn more and more about dementias, we're seeing you do better at accurate diagnosing, so those statistics kind of change a little bit. But there are about 1 million people that are affected with Lewy body dementia, and the lifespan can range anywhere from 2 years to 20 years. Most of the time, it's between a 5 and 7 year lifespan from a diagnosis to death. And we all know just because you were diagnosed at a certain time doesn't mean you weren't having changes several years before that. And the speed of the progression does vary widely, depending on what age you were when you were diagnosed, what other comorbidities you might be living with, how the disease is managed, et cetera. The difference between Lewy body dementia and Parkinson's disease dementia, which because they're confused quite a lot, is the timing of the onset of symptoms. And I'll talk more about that here in a few minutes. But like I said, this accumulation, these proteins are found on the outside of the brain and in the deep midbrain. These proteins, these Lewy bodies, are also found in people that have Alzheimer's disease, Parkinson's disease, and Down syndrome, and a few other disorders. So with dementia, and we know dementia is a gradual, progressive cognitive decline that affects most areas of a person, mainly memory, thinking processes, behavioral expressions, physical activity. But with the Lewy body dementia, they experience other symptoms as well as, or on top of these dementia, these common dementia symptoms. What you will tend to see is they might have some Parkinsonian movement disorders. This can be where they're real rigid in their movements or stiff in those muscle movements. They might shuffle their gait. They might have a mild tremor. Those things you see with Parkinson's disease. And they can also tend to have strong visual hallucinations early on in the stages of their dementia. So those are some common hallmark symptoms that you see that you don't see in another type of dementia like Alzheimer's disease or a vascular dementia. So here's a picture or a couple of pictures of what those Lewy bodies look like. In the upper left-hand corner, what it's showing you is like in the nucleus, that one neuron cell, there's the center of the nucleus, but then there's that Lewy body, that smooth round circle on the outside of it. The picture on the right, it's kind of hard to read, but it's pointing at it's a classic Lewy body. So they're pretty, I guess, fairly easy to see on brain scans within that nucleus. So like I mentioned, hallmark symptoms, what differentiates Lewy body dementia from other dementias. And again, you are seeing those classic signs of dementia that you would see in Alzheimer's disease. Along with, the memory loss, poor judgment. What you do tend to see in Lewy body dementia is they do tend to have more depression, as you would see in Alzheimer's disease. So that's kind of another symptom there that might clue us in to a more accurate diagnosis. But then also those motor movement problems with the Parkinson's. And where those Lewy bodies build up in the midbrain, or that deep midbrain, that's where Parkinson's disease starts also. So that's where those movement disorders come in, because of that toxic, the Lewy body protein buildup in the same area of the brain. Again, others might also have those hallucinations in there early on in the disease, because if you think Alzheimer's disease, people with Alzheimer's disease can have hallucinations, but they're not till much later in the disease process. With Lewy body, you're going to have them early on, and these hallucinations are reoccurring. So they might have the same hallucination frequently, several times throughout the week, and they're very vivid and very well defined. Something interesting is that they might be able to even tell you that they're having a hallucination at that moment. And they can be very aware of they're having that hallucination. And most of the time, the hallucinations, they're not scary. It might be a child or animals or something like that. So they're benign. They're not any, it wouldn't cause any upset. Another thing that can happen with Lewy body dementia, which distinguishes it a little bit more from the other dementias, is their fluctuations of alertness and confusion. With Alzheimer's and vascular dementia, other related dementias, there are, they have good days and bad days, right? And as the disease progresses, it's more, I have a good moment, bad moment. With Lewy body dementia, this alertness and this confusion varies significantly, and it can be from moment to moment. It can be from hour to hour, day to day, or week to week. But these fluctuations are an example of somebody might be conversing with you normally one day, and then the next day they're mute. Or say they wake up one morning and they're doing fine. Their movement is good, their confusion is good, they're talking with you, everything's all firing correctly. And then after lunch, maybe they're somewhat even non-responsive. They're not talking back to you, they're not moving, kind of like they're in a comatose state. So the fluctuations are very significant and can happen pretty quickly. So that's a hallmark symptom of this particular dementia. And then you also have the sleep disturbances. The sleep disturbances really come with, the REM, or the rapid eye movement sleep disorder, which what this looks like is they have very vivid dreams that they tend to act out. So they might move a lot when they're dreaming. They can talk in their sleep. When they're doing this, of course, they're not getting good sleep when that happens. So it can cause significant daytime sleepiness. And something interesting about this particular symptom is you can have sleep disorder problems several years before you start to notice other changes in getting a proper diagnosis for Lewy body dementia. So some people say, well, I really noticed sleep problems several years before anything else clued me into something else was going on here. So for about 70% of persons with Lewy body dementia, they do have the motor movement disorder or motor movement problems. And about 30% of Lewy body dementia patients, commonly the ones that are a little bit older, these symptoms occur first, those motor movement problem disorders. Other symptoms that likely occur in Lewy body dementia are listed here, and these symptoms aren't necessarily used in the diagnosing process, but they can be behavioral problems. They're more aggressive, more agitated, quick to anger, can be combative when we're doing self-care activities with them. More falls, really a lack of balance, right? Delusions can happen. They can have restless leg syndrome, that excessive daytime sleepiness, like I mentioned, can be somewhat unresponsive when they're doing those fluctuations. You can also notice some urinary system issues pop up as well, having difficulty swallowing, anger, depression, I mentioned, is seen a lot more in persons with Lewy body dementia, and autonomic problems. And this is, they can be more dizzy, or they might faint when they stand up or they get out of bed. Just the blood pressure drops so low. And they don't have a lot of control over their heart rate. They can have exercise intolerance, or maybe they're just sweating normally. So these can help us clue into an accurate diagnosis, but it's very difficult to diagnose Lewy body dementia. It's difficult to diagnose any dementia, but with this particular one, what makes it even more difficult is it resembles a lot of other dementias, but those symptoms overlap with the symptoms of persons that have Alzheimer's and Parkinson's disease. So it can be really hard to exclude or rule out Lewy body dementia specifically. None of the symptoms that we've discussed are specific to only Lewy body dementia. So they did come up with a set of diagnostic criteria. And what they're saying is what needs to be present is the cognitive decline that interferes with those normal activities that we'd see in any other progressive dementia. And then have two of the following, or one of the following. So the fluctuating alertness or confusion, the visual hallucinations, or those Parkinsonian movement disorders. There is also, and I didn't list it here because it's not on all research that I found, but it's also if they're having those sleep disturbances as well. In a diagnosis, they use those other symptoms like the falls, those autonomic problems, sensitive to medication. We're going to talk about medications. Will help them clue in to help rule out if it might be a Lewy body dementia or not. I'm going to skip to the second half of this slide because they will use brain imaging to help rule out another type of dementia. They can see certain types of shrinkage in areas of the brain. They can, they can see those Lewy bodies, those round proteins, but again, those proteins are also found in persons with Alzheimer's disease and Parkinson's disease. They use brain imaging to help rule out a stroke. And usually if they see something there, they're not going to diagnose it as Lewy body dementia. They'll diagnose it as another type of dementia. Blood tests, of course, can help rule out a vitamin deficiency, thyroid problems, a vascular issue. And then testing and treating for depression. Like I mentioned, you do see it a lot more in Lewy body dementia. The timing of the symptoms I mentioned, because there is a confusion about Lewy body dementia and Parkinson's dementia. It's the timing of when the symptoms happen. So if somebody is presenting with the motor movement problems and cognitive decline at the same time, or at least within 1 year of each other, it's most likely Lewy body dementia. So both cognitive decline and motor movements problems are presenting within the same year of each other. If the motor movement problems are presenting first, and it's not until a couple of years later that you see some cognitive decline, then it's most likely to indicate a Parkinson's dementia. That's really the only big difference between those two dementias. So how do we treat this dementia? Diet and exercise are going to be huge. Not only does this help improve the balance in some of those motor movement disorders, it can also help with possible sleep disorders as well. If you're getting the exercise tiring you out, right? Can help with that blood pressure if they have low blood pressure drops. And also working with physical, speech, occupational therapists, but also using music or other expressive art therapies to help with just general quality of life, but help with that cognition. It also helps with movement, because if I'm doing like an art therapy, whether it's coloring or I'm actually painting on a canvas, I'm having to really concentrate on small movements. And then the physical stuff concentrates on bigger movements. So medications, the medications that are used to treat Alzheimer's disease can also use in Lewy body dementia and help with some of that cognitive decline. Now, again, the backup, there are no medications that treat or cure, excuse me, I should say cure Lewy body dementia, but they can help manage the symptoms. So the same medications for Alzheimer's disease can help manage the cognitive symptoms of dementia and also can maybe help with some depression and anxiety. And they may also lessen the hallucinations if somebody's having those early on in the disease also. You can also use anti-Parkinson's drugs. So the drug that people with Parkinson's disease are generally prescribed is the levodopa. And this can help with the motor movement problems of the Lewy body dementia early on. I put on here, it can worsen psychotic symptoms or maybe increase the hallucinations and increase low blood pressure. So you want to really start low and go slow. So with Lewy body dementia and all the medication, you really got to work really closely with the doctor and have a lot of monitoring going on. Because if you're needing to manage sleep disorders, you would, hopefully a doctor would do a sleep study on them to identify if they're having more issues with sleep apnea, that REM disorder, that vivid dreaming and acting it out, restless leg syndrome, because different medications or different treatments will help each one of those. Clozapine is a medication that they use for sleep issues, particularly the REM disorder, and it can be effective, but we do want to use very low dosages. Again, start low and go slow, because some of the side effects, it may increase falls, it may increase confusion. Melatonin is a naturally occurring hormone, and we do kind of lose melatonin as we get older. So taking this over-the-counter medication can really help if there's some insomnia issues. Of course, you want to work with the doctor about the best dosage and timing, and the pharmacist as well, but that can be helpful. Avoid long naps during the day, avoid alcohol, caffeine, especially later in the day if they're having a hard time going to sleep, because that can be fairly common. And increase that daytime activity and that daytime exercise. If they're having excessive daytime sleepiness that really is significant, a doctor may prescribe a stimulant at that point to help them stay awake during the day. That's a little bit more rare, but it's an option. That's something that's affecting your loved one. And then we have the mood and behavioral problems. The treatments for this, of course, we want to try the non-pharmacological treatments first and foremost, and they're generally the most effective anyway. So this is making sure the environment is set up to where it's safe, it's secure, it's friendly, and it's familiar. They can navigate their environment independently. Managing any other medical issues. So like a sleep disorder, and some, like they're on a medication for that. We want to make sure that we do a medication review, because other medications can cause some confusion. Like sleep medications or even over-the-counter antihistamines can cause extra confusion. So just reviewing that medication and seeing, excuse me, what may be contributing to a mood problem or a behavior problem. Staying with a routine. You're getting up around the same time, you're doing your exercises around the same time, going to bed around the same time. That familiarity can be very helpful. And then light therapy, we have discussed this before, but there's artificial sunlight that you can buy, get it through a light and have it, and it's absorbed through the skin, and that helps people. It helps reset a sleep clock, but it also just helps with depression and mood as well. So just kind of a side note, I found this from on the National Institute of Aging, in particular with Lewy body dementia, but it's saying those with Lewy body dementia who receive certain anesthetics may become confused and delirious and have a sudden change in decline or their abilities, which may become permanent. So they go in for surgery, they get these anesthetics, and they come back, and it's like they just furthered onto the disease, or maybe even kickstarted something, and that's a permanent change. So depending on the procedure, you want to talk to the doctor about possible alternatives to anesthesia. Because there can be a spinal or a regional block that they can do. These alternative methods, are less likely to result in confusion after surgery. And also asking about strong pain relievers. Especially people with Lewy body dementia can become more delirious and stay delirious for a longer time if these drugs are used too freely. So just a side note. But caregiving for somebody with Lewy body dementia, this is because the caregivers are managing a cognitive decline, right? A progressive cognitive decline. But that comes along with behavioral changes as well, but they're also managing those movement disabilities too. So you want to make sure there's frequent assessment, there's frequent monitoring in the home, but also with the doctors, especially if there's medications involved, because people with Lewy body dementia are just more sensitive to medications across the board. Not that we can't use them, we just want to be very aware of side effects and symptoms that can cause, because if I want to take a sleep medication to help my loved one, I need to be aware that I got to be more vigilant about falls. Something like that, because you're just a lot more sensitive to how medications interact with them. And also just, we got to be physically more helpful for people with Lewy body dementia, especially if they have those autonomic problems, just helping them get up out of a chair or out of the bed to make sure they don't fall, to decrease those risks for falls. And be skilled in redirection, especially if they're having those hallucinations. Generally, they're not scary or upsetting hallucinations, but there might be a time when we need to redirect them away from that, or redirect them away from extra confusion, and just be skilled in how to do that, and how to use the environment to help with that. And of course, support groups. Support groups to be able to talk to people and hear from people that are in the same situation as you. What have they tried? What are they living with? And just really normalize those feelings that you live with, that you go through, and those fluctuating feelings for you can really help be therapeutic and be healing for a caregiver. And then there is the Lewy Body Dementia Association. So they have a really great website that they have support groups that you can join through them, virtual for right now. But they have education on that website. They have opportunities for research. They have other resources on that website. And so I encourage you to visit that if you haven't already. And of course, to stay connected with James L. West. And we are doing education all the time. We talked about redirection techniques and just how to support the caregiver. All of those, no matter what type of dementia you might be living with, those techniques and that education and the community that's being built within our support groups and frequent education participants really helps build that community and just helps you through the journey of caregiving. I'm going to stop sharing and ask if there are any questions or comments or anything anybody want to share. I will say, yes, I'm going to send you the slides after this, along with a copy of the recording. So, but are there any questions or comments? Yes.
Question about the anesthesia. Does it affect all the other kinds of dementia, or is it more the Lewy body?
It does. It affects all kinds of dementia. It might be a little bit more prevalent with Lewy body dementia, but if you have a loved one that's going to go into for a surgery, you really want to ask about the effects of the anesthesia. Are there different alternatives? Because for anybody, I mean, if I went under anesthesia, I could come out more confused, and it might take a while for that to go away. But for some people, it might not ever go away. And that also depends on what they're already living with dementia changes.
Jamie, can you give us some examples of how to redirect away from hallucinations and confusion?
Yes. I think the first or one of the best ways to redirect if somebody's having hallucinations is change the environment. And that could be something small, to like closing the curtains or getting them out and just moving them to a different room. And you want to start with validating it. You don't want to tell them they're wrong or that they're hallucinating or that nothing is there. Because to them, it's very real. I mean, you're not going to convince them otherwise. So it's just saying, if they're having, if they're real mad because there's kids, they're hearing and seeing kids and they're being loud and rambunctious, just say, kind of agree with it. What, those kids are really annoying. Let's get out of here. And we'll call their parents to come pick them up. Let's go to this other room. And you change the environment, and it kind of helps set their brain. Okay. Now, they might see it again because generally they're reoccurring, but just kind of those redirection techniques like Or if they're seeing a scary person walk outside, let's close those curtains and let's call the neighbor and make sure they check on them. We'll get rid of that guy. You know, kind of validate where they're at, but then quickly change the environment and move on to something else. Does that help?
Yes, yes.
And if anybody else has any ways they redirected, please share.
My wife had the bad dreams. She thought bees were flying down in her mouth, and then she thought her hands were on fire. So that's two different hallucinations. They reoccurred for several months, and then they went away. Then I guess that was the earlier stages. Now that I hear the progression of the disease, the Lewy body, man, she falls right into that. But you know, she had other problems also.
Well, Wilson, how did you redirect, or what did you do when she was having this?
Well, I put her hands out. You know, she said, you know, she's on fire. I knew she was on fire because it had happened, and I'd put her, and it wouldn't last long, you know, maybe 15 seconds, you know, but it was real, and it was a real hard 15 seconds for her, real long.
Sure, yeah.
You know.
Anyone else have a comment or a question? Well, Wilson, thank you for sharing. Thanks for the questions. And we'll send out these resources this afternoon. And we hope to see you again soon on another support group or another program.
Thank you.
Thank you all.
Thank you.